Okay, the translation has started. And before starting today's lesson, which is the topic is uh, chronic heart failure or chronic heart failure, I just want to go back to the previous lesson. We talked about loading dose and maintenance dose. Do you remember at the end of the lesson? And I just want to go back because I think it's important topic. So you see, right? No. Okay. So again, loading dose, начальная доза, maintenance dose, поддерживающая доза. And if you see IV, it's intravenous, meaning внутривенно. IM is intramuscular, внутримышечно. Bolus is bolus, oral перорально, and titration translated as титровать. So here is, for example, the table from the ESC guideline. For example, here they explain the dose regimen of the antiplatelet therapy. So here you will see the, for example, abbreviation as LD, which is loading dose. Then you see here IV, intravenous, OD. What was that?
Один раз в день.
Once a day. So what else? For example, do you know what is CKD?
Chronic kidney disease. Maybe.
Yes, you're right. No? CKD is chronic kidney disease. And there are many abbreviations. So CKD is also seen in the guidelines of cardiological topics, of course. And also, for example, PCI, you already know it, right? Which is percutaneous.
Yes, coronary intervention.
Yes, right. And also sometimes you will see PPCI, which is primary percutaneous coronary intervention. Первоначальный, да, первичный. And for example, here you see CRCL, which is, do you know?
Creatinine, clearance creatinine.
Yes, right, great. It's, I think that's it. For example, everything else I think understandable. And now let's join the Nearpod to revise the vocabulary of the previous lesson. Dr. Bibigul, have you joined Nearpod?
Yes, 1 minute.
Dr. Bibigul, you have not. Did you see the translation like on YouTube recording?
I see video on stop.
Okay, good. So let's start. The first it's matching pairs from the previous lesson. Dr. Bibigul, do you see because I don't see your name.
I see the video
Video?
from Grey's Anatomy. No?
No. You should join. I think you joined the previous Nearpod.
Новый нейрпод вроде... здесь нет.
Сегодня
Всё,
вот
вижу.
вместе.
Вместе отправили. Все, вижу теперь.
Все.
Извините.
Все, подключились.
Угу.
Okay, great. You both did it from the first try, so I don't want to stop on that. So today's topic, chronic heart failure. And we already did. So today's objectives are to understand the use core vocabulary related to heart failure, describe some symptoms, diagnostics, and treatment. Also, we'll see one scientific paper, clinical trial, and also read the guidelines on the heart failure and have a speaking session. So, as always, we start with warm-up discussion. So, have you ever treated a patient with heart failure in your practice? Does it commonly?
Yes.
And how you would explain the heart failure in your own words, and what are the symptoms of heart failure you usually see?
Shortness of breath, edema, and orthopnoe, how it's called.
Yes, it's called, it's the same.
Yes. Usually, this is symptoms, and patient usually says that palpitation, maybe sometimes, and sometimes dizziness and fatigue.
Okay. And Dr. Bibigul, please join our discussion. What is the most common underlying cause of heart failure, actually?
Underlying это...
Underlying, what is the cause of this heart failure? Usually something leads to this.
First thing is STEMI, non-STEMI, да?
Myocardial infarction.
Myocardial infarction, yes. And arterial hypertension for a long time. Then some types of cardiomyopathy. Cardiomyopathy. And sometimes of severe
Arrhythmias. Great, okay. And sometimes some patients may have congenital heart defects, то есть врожденные аномалии развития, врожденный порог сердца.
А приобретенный как будет, извините?
Приобретенный, I don't know, I don't think that we have such kind of how to say
Okay.
phrase. Okay. So congenital, it's usually used as for врожденные пороки. So maybe like приобретенные would be like acquired artifacts. Yeah, I don't think.
Уже погуглим.
Да, можно, кстати, посмотреть. But I haven't seen. I think it might be like acquired. Okay. So today's vocabulary focus. Please, Dr. Yerkem, you can read first half of the words.
Okay. Preserved ejection fraction. Сохраненная фракция выброса. Reduced ejection fraction. Сниженная фракция выброса. Mildly reduced ejection fraction. Mildly reduced ejection fraction. Умеренно сниженная фракция выброса. Improved ejection fraction. Улучшенная фракция выброса. Loop diuretics. Петлевые диуретики. ACE inhibitor. Ингибиторы АПФ.
You can pronounce it ACE inhibitors.
ACE, inhibitors. Inhibitor APF. And angiotensin receptor neprilysin inhibitors.
Angiotensin.
Angiotensin receptor neprilysin inhibitors. Антагонист рецепторов ангиотензина и неприлизина.
Dr. Bibigul, you can read.
Water retention, задержка воды в организме. МРИ, минералокортикоид, рецептор, антагонист. Антагонист минералокортикоидных рецепторов. Underlying, лежащий в основе, фоновый. Crackless, крепитация. Result in, приводить к, вызывать что-либо. Cardiac output, сердечный выброс.
Which words are new for you? Have you seen or you know these words?
Most of words is new for me.
Me too.
Okay, so here you see near the preserved ejection fraction, abbreviation HFpEF, which is heart failure with preserved ejection fraction. То есть in most of the guidelines and papers, you will see such abbreviation. Mostly they do not write like heart failure with preserved ejection fraction. Just use this kind of. And the second one we see R, which is reduced ejection fraction. Heart failure with reduced ejection fraction. ACE inhibitors, which is angiotensin converting enzyme inhibitor. Enzyme, how it's translated?
Ferment.
Да, ferment. So angiotensin converting enzyme inhibitors, they usually pronounce as ACE inhibitors, while, for example, angiotensin receptor neprilysin inhibitors, they pronounce as ARNI. And it would not be a mistake. And MRA, which is mineral corticoid receptor antagonist. So this is what I wanted to focus on. Okay. So let's go to your nearpod again and practice these new words. Okay, great. So, except that, for example, preserved это сохранное and reduced снижение. То есть these words could be used not only for the, of course, for the ejection fraction. You may use it while you are speaking with about another topics not related to medicine, and improve улучшенное, or in other words, could be восстановленное. Okay. So let's now read the small paragraph from again from the ESC guideline. Dr. Yerkem, I think you can read first 2 sentences.
Heart failure is not a single pathological diagnosis, but a clinical syndrome consisting of cardiac symptoms, breathlessness, ankle swelling, and fatigue that may be accompanied by signs, elevated jugular venous pressure, pulmonary
Jugular. Jugular.
jugular venous pressure, pulmonary crackles, and peripheral edema. Peripheral edema. It's due to a structural and or functional abnormality of the heart that results in elevated intracardiac pressures and or inadequate cardiac output at rest and or during exercise. Сердечная недостаточность — это не как не один такой диагноз единственный, но это клинические синдромы, которые включают, получается, кардиальные симптомы. Это
not cardinal symptoms, not cardiac. It's cardinal symptoms. I actually haven't found like exact translation for Russian, but cardinal symptoms mean some like core symptoms that define this disease. То есть симптомы, которые именно отличают, да, какое-то заболевание от другого. These all symptoms called cardinal symptoms. Okay, and here we have some examples. You can proceed.
Breathlessness, получается, это как нарушение дыхания?
Да. You can use it as the same as shortness of breath and the same as for dyspnea.
Dyspnea.
It's all отдышка.
Отеки голени, получается, и усталость, которая может также идти вместе с этими.
Accompanied, сопровождаться.
Сопровождаться, да, с признаками. Это, например, повышение югулярно-венозного давления. Это
как давление в еремной вене.
В еремных венах. Крепитация в легких и периферические отеки. Это может также...
It is due, means это из-за.
Это из-за структурных или же функциональных изменений сердца в результате повышения внутрисердечного давления и неадекватного сердечного выброса в покое или же во время физической нагрузки.
Okay, great job, Dr. Yerkem. So, jugular vein, it's еремная вена.
Jugular vein,
So, everything else, I think, is clear. Okay, Dr. Bibigul, you can proceed with reading and translation.
Okay, identification of the etiology of the underlying cardiac dysfunction is mandatory in the diagnosis of heart failure, as the specific pathology can determine subsequent treatment. Most commonly, heart failure is due to myocardial dysfunction, as systolic, diastolic, or both. However, сюда.
No, you can proceed.
Okay. However, pathology of the valves, pericardium and endocardium, and abnormalities of heart rhythm And conduction can also cause or contribute to heart failure.
So 1 second, I want to tell, like either, it's pronounced as either, systolic, diastolic, and also determine subsequent treatment.
Determine subsequent treatment, окей.
Мгм.
Identification of the etiology. Так, идентификация, да, причины, лежащие в основе сердечной дисфункции, это mandatory, это что?
Mandatory обязательно.
Ага, обязательно это диагноз сердечной недостаточности, как специфическая патология, как специальный, да, или как?
То есть here they use it like для диагностики, да, сердечной недостаточности, как специфическую патологию, которая может
Который может определить, так, subsequent, типа как
subsequent последующий.
последующее лечение.
Мгм.
Subsequent.
You can also use, for example, this word subsequent as in the beginning of the sentence, like subsequently, we started, I don't know, ACE inhibitors for this patient, for example. So subsequently could be used as, да, в дальнейшем мы бла-бла-бла, да, использовали. Окей, next.
Обычно, да, most commonly.
Most commonly, чаще всего.
Чаще всего сердечная недостаточность зависит
Is due to, это из-за.
Из-за миокардиальной дисфункции, как систолической, так и диастолической, или обеих. Однако, или однако, да?
Да, однако, you're right.
Однако патология так, клапанов, перикарда, эндокарда и так, ненормальный сердечный ритм и состояние, да, conduction?
Conduction, как?
Состояние или как?
Not, не состояние. Conduction, проводимость.
Проводимость. Получается,
Can also, тоже может.
Тоже
также,
может,
да, то есть также может.
Также может привести к сердечной недостаточности, да?
Ага. Cause это как причина.
Причина.
Contribute, как сказать?
Вызывает.
No. Contribute, то есть добавляет, да? How to explain? Maybe Dr. Yerkem could help. Contribute, то есть contribution это у нас будет как бы такое участие в чем-то принимать, да, и если contribute, это уже будет как
Участвует.
вклад, да, вклад, вот больше, наверное. Да, вклад или способствовать чему-то вот в таком плане. Contribute is a verb, and contribution это уже будет существительное. So great. What are the words that was new for you, were new for you that you, for example, write it down for yourself?
Mandatory и conduction. Проводимость.
What about Dr. Yerkem?
Cardinal symptoms and
Okay. Great. So actually about jugular venous pressure, also it could be like у нас CVD, да? Будет вот это тоже jugular venous pressure, and also it's abbreviated as GVP. And also while you're speaking to your colleagues, to other doctors, you also may use like GVP abbreviation. Okay. So let's again do the exercise 3 in Neopot. Right? So here you see the words with definitions. Okay, great. So shortness of breath and dyspnea are the synonyms. Yeah. Okay. Here now we are moving to the grammar tip. Do you see my screen?
Yes.
Yes.
So we use sometimes adjectives and collocations to describe heart failure. Last lesson I explained you briefly when we use mild, moderate, and severe, which is like легкое, moderate умеренное, severe тяжелая степень. And also, especially it is used in heart failure, severe heart failure, moderate heart failure, mild heart failure. And except that, for heart failure, we can use to, how to say, to show some worsening or if this patient is stable, like acute and chronic. Acute острое, chronic хроническое. Chronic stable, хроническое стабильное. And also, we already talked about reduced and preserved ejection fraction. And usually when we describe the patient, for example, the patient has, we start with severity, then we write type, plus heart failure with and the status of the ejection fraction. For example, the patient has moderate chronic heart failure with preserved ejection fraction. And sometimes we can use like left-sided heart failure or right-sided heart failure, right? То есть правой стороной, левой стороной. And to practice this, we will do some couple of sentences. So you need to use this template at the top, like the patient has severity type heart failure with ejection fraction status. You should do the sentence using, for example, here for the first one, severity is moderate, type chronic, ejection fraction preserved. Let's start with Dr. Bibigul.
А можно Ирким начнет? Я что-то немножко не поняла, хочу догнать.
Все хорошо. Or I can show you the example. For example, here in the first one, you need to write your sentence using this template. The patient has moderate chronic heart failure with preserved ejection fraction. Okay.
Мгм.
And for the second, we have another one. They are the same. You should use the same template for all of them, just changing the severity type and ejection fraction.
Okay. The patient has acute decompensated heart failure
Mhm.
with reduced ejection fraction.
Okay, great.
Okay, thank you.
Next, Dr. Irkem.
The patient has left-sided heart failure
Mhm.
with preserved ejection fraction.
Right, great. Dr. Bibigul.
The patient has так, moderate
Mhm.
right-sided heart failure
Mhm.
with reduced ejection fraction.
Right. And for example, Dr. Yerkem, let's do this one with Do you remember on the first lesson we were talking about the patient presents to the cardiologist and blah blah blah.
The patient presents to cardiologist, complain of with chronic stable or no severe chronic stable heart failure with reduced ejection fraction.
Right. So here you can tell like with the diagnosis of
With diagnosis.
for example, it's not a complaint. Yes, it's actually we can tell that it's the diagnosis that already known. Okay. Again, let's move to Nearpod. I will open it. Here you should fill in the gaps. 1 second. I think it's not downloaded yet. Okay, good. So, which words were new for new to you? Which one you want to translate with me?
Retention. Это
Задержка, да?
Да,
задержка,
задержка.
да?
Water retention. It was in our vocabulary of today. Okay. What else? For example, therapeutic implications. Do you know what is that? Okay, so here you see, when evaluating a patient with suspected heart failure, clinicians must differentiate between heart failure with preserved ejection fraction and reduced ejection fraction, as each phenotype carries distinct therapeutic implications. То есть, как так как каждый, да, фенотип carries could be translated in two ways. Carry как бы нести, and also in other words we can tell. Okay. Do you see my screen now?
Yes.
So here phenotype carries выполняет. Да? Мы здесь как бы несет перевести не можем, но будет больше правильнее, как выполняет. Distinct. How is translated? Отчетливый, да? Отличительный, да. Therapeutic implications. Implications как переводится последствия, да, то есть терапевтические последствия. They mean that depending on the status of the ejection fraction, the therapy would be different. Yes. Sometimes it cannot be like translated to Russian in like this strange way. Accumulate. What is that?
Типа как суммируется, да? Собирается,
Да, накапливается.
накапливается.
Also, orthopnea, it's clear. The same. Result in. And for example,
Deterioration.
так, let's translate this sentence. This fluid overload. Please read this sentence and let's translate together.
This fluid overload may result in increased cardiac stress and a further deterioration
Good.
of functional capacity.
Let's translate.
Это перегрузка жидкостью, да?
Great. Overload как перегрузка.
Может быть результатом
Result in, да?
привести к сниженной, повышенному сердечному стрессу, нагрузке, да, и дальнейшему ухудшению,
улучшению функциональной
возможностей.
Great. So, okay. Increased, повышенный, decreased,
сниженный.
Да, сниженный. Okay, and what is recurrent here in the last sentence? Have you heard? It means, for example, when the disease recurs, то есть рецидивирующий. In the meaning, it translates as возвращающийся, повторяющийся, but in medical settings we can use as recidive. Okay, great. And we already talked about the classification, of course, of the heart failure. So what is the range of like ejection fraction to be preserved or reduced? How it's differentiated?
From 50.
Okay, Dr. Bibigul.
From 50 and выше.
How it would be?
Would be preserved.
More than?
More than 50 years. From 40 to 50 is mildly reduced. And less than 30 is reduced. 39 is reduced.
Okay. Dr. Irkem, do you agree on that?
I mean, 41 and 49 is mildly ejection fraction.
Mildly?
Mildly more. 50 and more it's mean preserved.
Mhm.
I think, and reduced it's 40% и меньше.
So how would it be меньше? How it's translated?
Less.
Less than. Usually we use like less than, more than. Okay. So here's it's not the ESC, it's American Heart Association guideline. They like classify it according to like when a left ventricular ejection fraction. Do you see the abbreviation LVEF, which is left ventricular ejection fraction, less than 40? This is more than 40. Okay. Okay. To focus here, that's it, I think. Do you know what is follow-up measurement? What is follow-up actually?
Это как улучшенная фракция, нет?
No. Follow-up means, for example, patient comes to you for the first time. He had an appointment with you and you prescribed some medications. And to check whether this medication help or not, they actually come back for the follow-up. То есть повторный прием, да, так скажем, когда у нас есть дополнительные вопросы, да, follow-up questions. Usually you will see it in research papers. For example, they had a study and after 5 years the patients come to follow up. То есть на повторные, да, так скажем, когда их оценивают повторно.
Типа последующие, да?
Да, последующие, вот в таком плане. Тоже нет, как сказать, прямого перевода. Они чаще используют, вот, когда вот приходит на последующий прием, и вы проверяете, помогает ли это лекарство, к примеру, в таком плане. Да? Как повторный прием даже, можно сказать. And for example, when you tell your patient, please come to follow up in 3 weeks. Yes. So we will check your condition, whether our treatment helps or not. Yeah. And what does evidence of spontaneous or provocable increased LV filling pressures, how it's translated? Evidence.
Доказательства.
Доказательства. Spontaneous.
Спонтанного.
Provoke.
Я не знаю.
Провоцировать. То есть провокационный, да? Спровоцированный. LV filling. What is filling?
Ну, это заполнять.
Заполнять. Great job. So that's it. It's actually I added all of this like text and screens from the guidelines and papers in order for you to easily read all of these guidelines in the future.
Окей, thank you. Обновили знания некоторые.
Да, of course, I can't teach you cardiology, but
Мы же все
reading these
доктора.
guidelines. Ну да. Okay, so here the speaking practice. Dr. Yerkem, I think you can start. I want you to describe this graph in your words. For example, starting, this graph shows the management of patient, blah, 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 and they use this kind of drugs. Okay?
Management of patient with a heart failure with reduced ejection fraction. The class 1, it's recommended to use the drugs. It's include ACE inhibitors or ARNI, beta blocker, MRA, and dapagliflozin or empagliflozin, and also loop diuretics for fluid retention. It's usually called quadrotherapies
Great.
in treatment. And when we look at the ECG, and if we see the QRS complex is a millisecond, less than 35%, we recommended ICD. That's class A when it's non-ischemic, and class 1 is ischemic. Yes.
Okay, next.
And if left ventricular ejection fraction more than 35%, or device therapy not indicated, or
Inappropriate.
We usually recommended it if symptoms persist, consider therapies with class 2 recommendations.
Consider.
Uh-huh.
So here, like, do you know how indicated and inappropriate is translated?
Indicated это как этот, не показано, да?
Да.
Или не рекомендуется использовать, unappropriate.
Inappropriate.
Appropriate.
Это больше как неправильно, but you're right. In like in Russian speaking, we can tell like не показано, да? Okay. And if system persist, продолжаться, да? Если симптомы продолжаются, consider рассмотреть терапию.
Рекомендация второго класса, да?
Да. And ICD is implantable cardioverter defibrillator. Actually, all of these device therapies will be discussed, I guess, starting from the next session. We will talk about arrhythmias and these device therapies. So no need to focus on that now. Okay. You can proceed.
And if we see the sinus rhythm on ECG and left ventricular ejection fraction less than 35% and the QRS complex more than 130 millimeters, we recommended milliseconds. We recommended CRTT or CRTP. Usually difference the QRS complex 130 and 149 millisecond, and the QRS complex more than 150 milliseconds.
Great job. Okay, so I just wanted to hear exactly to practice more than, less than, and also the like abbreviations that should be like clear for you while you're reading. Okay, so now I just want to briefly discuss this Paragon HF trial. Have you heard about that?
I don't remember.
Don't know.
Okay. This is the paper which was published in 2019. Actually, there are several different trials assessing angiotensin neprilysin inhibition in heart failure. Here, in exactly this paper, they assess especially the preserved ejection fraction in patients with preserved ejection fraction. And after that, we'll discuss like these questions that you see. Actually, this is just a brief summary. For example, you see here methodology. Да? Do you know which is how randomized double-blind is translated?
Рандомизированная, двойная слепая.
Active comparator trial.
Я не знаю.
Активно-сравнительное. Да, испытание. and conducted in 412 cities in 43 countries. And they actually used sacubitril valsartan with in control patients. They used it. Also, they used valsartan only to check whether valsartan only or sacubitril valsartan would be more effective. So, and here is two sentences. I want Dr. Bibigul to read and translate.
Patients were evaluated at trial visits every 4 to 16 weeks.
Мгм.
Пациенты оценивались при каждом визите каждые 4 и 16 недель, да?
Мгм. Trial visits, they mean like trial это у нас испытание, visits как бы посещение, да? Как бы их визиты, когда они участвуют в этом исследовании, да, так скажем.
Мгм.
Мгм. Next.
Renin-angiotensin system inhibitors other than mineralocorticoid receptor antagonists were
Discontinued.
discontinued before the run-in period, but all other background medications were continued.
Мгм.
Um,
So here you see new group of drug, renin-angiotensin system inhibitors, RAS inhibitors.
ага, блокаторы раз,
Мгм.
чем так, антагонисты минерально-кортикоидных рецепторов, да,
Мгм.
были discontinued before the run-in.
Ага. So the structure in Russian would be different. То есть ингибиторы раз, кроме минералокортикоидных рецепторов, ой, блин, извините, а, антагонистов рецептора минералокортикоидов были discontinued, what is that?
Остановлены, да, типа?
Да, приостановлены до what is run-in period.
Так.
Это период до начала исследования.
Мгм. Но все остальные, да,
Да.
background medication, все остальные предыдущие лекарства были продолжены.
Мгм. They mean like background medications, то есть у кого другая, да, функция у лекарств, механизм действия, они продолжили. Да?
Мгм.
Okay. So here also Dr. Yerkem, please read this.
In this trial involving patients with heart failure and preserved left ventricular ejection fraction, we compared treatment with sacubitril valsartan with treatment with valsartan alone. The primary composite outcome of total composite outcome of total hospitalizations for heart failure and deaths from cardiovascular causes did not differ significantly between the two groups. The findings from the 9 pre-specified supportive and sensitivity analysis were consistent with those from the primary analysis.
I'm sorry, I forgot to tell you that this is the summary of the results of this trial. Because they were assessing which one would be better, and here the final results of the trial. Okay, let's translate.
Получается, среди этих исследуемых пациентов, да, с сердечной недостаточностью и с сохраненной фракцией выброса мы
сравнивать.
Мы сравнивали лечение с сакубитрил valsartan и лечением только с сакубитрилом.
Только valsartan.
Только valsartan. Главное
Here the primary composite outcome, первичное, да, composite is translated here as complex outcome, то есть outcome, то есть первичный такой комплексный результат, как сумма результатов, вот в таком плане.
Тотальной госпитализации.
Total hospitalizations это как бы количество госпитализаций.
Количество госпитализаций для сердечной недостаточности и смертности от кардиоваскулярных причин не были разделены, да, или как?
Не отличаются
Не
significantly,
отличаются.
значительно. То есть они не отличаются значительно между
двумя группами.
The findings, находки
из 9
pre-specified, то есть pre-specified получается до того, как у нас начался сам trial, у них уже были подготовленные, да, так скажем, да, перед самим основным trial. То есть поддерживающие и sensitivity analysis, анализы на чувствительность. Here, like they're talking more about statistical analysis, которые уже были consistent, то есть схожие уже с другими первичными анализами самого вот этого главного исследования. То есть у них сначала были 9 таких маленьких, да, как case studies или cohort studies, и затем они уже вот этот trial ждали. Okay. So, do you have any questions at this point? Понятны ли вопросы? Ой, слова?
Еще нет, надо повторить.
Okay. So, I just added also today's actually lessons focus is mostly like on reading. Some of the lessons would be focused on speaking, and it would be like different each session. И доктор Бибигуль, now you can proceed.
We did not find a significant benefit of sacubitril valsartan in patients with heart failure with preserved ejection fraction with respect to the primary composite outcome of total hospitalizations for heart failure and death from cardiovascular causes. Мы не нашли, да, значительные benefit, это как типа...
Benefit, польза.
Да, польза. Сакубитрил валсартана у пациентов с сердечной недостаточностью, с сохранной фракцией выброса. Так, с уважением.
With respect to, not с уважением, respect это уважение, but with respect to в отношении к.
В отношении к первичному.
Или относительно.
Относительно к первичному. Так, композит.
Composite outcome.
Общему выводу, да?
Да, исходу. Или
общему
результату.
исходу. Outcome. Так, of total hospitalizations. Число госпитализаций для сердечной недостаточности и смертности от кардиоваскулярных причин.
So total hospitalization, даже можно сказать как общее число.
Общее число госпитализаций.
So, как бы количество будет это не как сумма, да, а нам нужно именно все госпитализации. В таком плане. Общее число. Okay. Next.
In the context of known benefit of this treatment in patients with heart failure and left ventricular systolic dysfunction, and with the suggestion of a differential effect of sacubitril valsartan in our trial in relation to left ventricular ejection fraction. Future research should focus on the potential role of angiotensin receptor neprilysin inhibition in patients with heart failure and ejection fraction that is below normal but not frankly reduced. Капец, какое длинное предложение.
Okay, let's translate.
В контексте, зная пользу лечения у пациентов с сердечной недостаточностью и левожелудочковой систолической дисфункцией, и suggestion это
Suggestion. What? Suggest. Предлагать. Suggestion. Предположение.
предположение разных эффектов, разных закуподрил валсартана в нашем исследовании. Так, in relation
Или here like trial is, может даже испытание больше, да? Исследование would be better to translate like research or study. Trial.
Это будет испытание.
Да, испытание.
Ага, испытание, так, relation относительно, да? В отношении? В отношении к левой желудочковой фракции выброса левого желудочка. Будущие исследования будут фокусированы, должны фокусироваться на потенциальном роли ангиотензин рецептор неprilysin ингибирований у пациентов.
Ингибиторов неprilysin и ангиотензинового рецептора.
У пациентов с сердечной недостаточностью, с фракцией выброса, которые
меньше нормы.
Меньше нормы, но больше, да?
Frankly, like means, честно говоря, for example, you can use this word when you're speaking, like frankly speaking, like откровенно говоря, да? You can use it. But here in this context, not frankly reduced means не так, как сказать,
не сильно, да?
Откровенно, да, сниженный. То есть
не откровенно сниженный.
Не совсем сниженный.
Не совсем сниженный.
Okay, great job. So how is this text? Is it like advanced or it's more or less understandable?
I think it's advanced.
Yes, like some papers, some research papers may use some like, different language in regards with, for example, guidelines. Yes, here you would see more like how to say terms from statistical analysis, for example. Yes. While in guidelines, you would see it not commonly. Okay, so finally, like let's discuss this paper. So, do you think this like angiotensin receptor neprilysin inhibitors should be initiated superior to ACE inhibitors? Do you think it's like provide meaningful clinical benefit in patients with preserved ejection fraction? Do you think? Do we usually use in your practice sacubitril valsartan?
Yes.
Yes.
Do you use it in patients with preserved ejection fraction?
No.
No.
Mostly in reduced ejection fraction, right?
Yes, mostly in reduced.
And what is the first line therapy?
First line is a quadrotherapy for patients.
How actually differs the therapy for preserved ejection fraction and reduced ejection fraction?
Mm.
In Kazakhstan, I know that preserved ejection of heart failure with preserved ejection fraction, preserved, ejection fraction. It isn't как сказать, treated. Most
Еще
commonly.
раз. Как?
В Казахстане не часто лечат ХСН с сохранной фракцией. Мы просто пишем, а так, что прям квадротерапию назначать, это не так часто происходит.
So sometimes more like watchful waiting, yes? You just check
Yes.
regularly. You
Yes,
like, for example.
follow-up sessions.
So they are regular. Great. Okay. I'm happy that you remember new words. Okay. So here is that key findings of this paper. And in conclusion, they come up that the RNA was not associated with decreased cardiovascular mortality and heart failure hospitalization. То есть не показал, да, как сказать, улучшений именно in terms of cardiovascular mortality. What is mortality?
Смертность.
Смертность, да. То есть не снизил смертность и число госпитализаций, да, у пациентов с сердечной недостаточностью. Okay. Actually, preparing for the session was also interesting for me as well, because I need to read all these guidelines and papers before the session. I'm preparing for my cardiology rotation, I guess, with you. So, okay. What are the, how to say, your feelings about today's session?
It's very interesting, but
Sorry, I can't hear you, I guess.